Diabetes is one of the most important risk factors for heart problems. India is almost the diabetes capital of the whole world, more than 32 million cases. So there is an impending epidemic of a heart ailment coming up. To prevent the heart attacks and to save people from surgeries is one of the main mission of IPC. Under this, we run the diabetes reversal program because we want to control the diabetes effectively so that the diabetic patients do not become heart patients. Generally, the relation is diabetes is a mother and heart disease is a child. Anybody who is a diabetic has almost 2 to 3 times more chance of getting a heart problem than a non-diabetic. Another problem with diabetics is that they get multiple blockages leading them to bypass surgeries. Also, when bypass surgeries are done, the chances of wound infections and complications are more if the sugar is not controlled. Also, there is diffuse disease, that is, the disease is also in the smaller vessels. So very often, even after bypass surgeries, they are not completely benefited. So now you can understand that why controlling diabetes is so very important. And at IPC, where we specialize in treating heart cases, we take special care of the diabetes people because we help them in controlling the sugars to normal levels. Another problem which is faced is that in spite of taking medications or insulin, the diabetes is not controlled. This is where precisely the diabetes reversal program comes into play. We have treated very challenging cases where in spite of taking insulin more than 100 units a day, there was no control of sugar happening. At IPC in this program, we carefully evaluate the entire lifestyle, the diet, the exercise pattern, most important the mind pattern. We have seen that there is a certain mindset which makes diabetes a diabetic patient. D is for diabetes and D is for discipline. If we live a disciplined lifestyle, diabetes can be controlled. Most often diabetics do not take care of their food or discipline their lifestyle in terms of walking and exercise, and also they have a type A personality, which is what we call hari bari kari. When all these factors are taken into control, there is a very good sugar control. How this is different from the routine diabetic management which is offered? Very often doctors are very busy in their routine practice and they always see the blood sugar report and accordingly the doses are monitored. It is like when we do a business, there are two partners, active one and the sleeping partner. But if both the partners are active, then the business is done well. Similarly, if the patient is keeping on doing all the activities in a day, which will keep on increasing more sugars, just that medicine is not going to help. So very often we see that the diabetics, they visit the doctors, they keep on taking prescription every 3 months and the dosages keep on increasing only. The difference here is that we give a customized lifestyle program which helps the patients to understand that why the sugars are increasing, strike the root causes and work hand in hand with the patients so that the sugar is effectively controlled and the medicines are reduced, and in selected cases we have even been able to stop insulin. To know more about it, you can go through the website or visit the IPC centers for a consultation where as per your ailment, what is the severity, what results could be achieved, can explain to you on a one-on-one basis. Thank you.